Hello everyone, this is Dr. Neha and welcome to this video brought to you by the NDEB Strivers. This is the second video in the series Blueprint and References. In the first video, we talked about the pharmacology, local anesthesia, medical emergencies, and medicine, including physiology, where Dr. Mustafa talked about 24% of the questions, that is the 48 questions, which would be from this section. So here in this video, we're going to talk about the orthodontics, the pediatric dentistry, geriatric dentistry, special needs, including oral embryology, growth and development. So this section, this would include 10% of the question, that is almost 20 questions would be from this section. And if we look at this section, so I think the most important of all of them is the pediatric dentistry and the concepts regarding the pediatric dentistry. So let's move to the next section. So of all of them, the first we're gonna we have divided it into various sections, and first we're gonna talk about the orthodontics and the growth and development, the references, the articles, and then the important topics. So the references for the orthodontics and growth and development is Profit, WR 2018, Contemporary Orthodontics. It's a 6th edition book and it's a very beautiful book which is divided into 7 sections, and it explains all of the orthodontics right from the orthodontic problem to the diagnosis, treatment planning, how do you manage in the pre-adolescent stage, the growth modification, contemporary ortho devices, and in the last, orthognathic surgery. And regarding the articles which are mentioned for the ortho is the by American Association of Orthodontics. It is glossary of terms. And in the glossary of terms, there are mainly definitions which are related to ortho. And I think I've seen some questions where they ask about the definition, like the exact definition with the confusing words which would be given, and then the definition, the real definition would be asked. So I think the glossary of terms is important for the ortho, and as well it is also important in the endo. So in the endo also we have glossary of terms. Then there is another article, though the reference is not there with the NDEB, but it's an important article where they are discussing about the unilateral crossbite with a shift, a review. Again, a very beautiful article. The important topics for the ortho, growth and development, though ortho and growth and development are given differently, but they have like several topics which are overlapping. So I have like revised it here. Both of them are revised together here. So the first important topic is the concept of growth and development, the concepts of the pattern, the variability and the timing. Then the site and type of growth in the craniofacial complex, which starts right from the cranial vault, the cranial base, the maxilla, and the mandible, especially the mandible, where they talk about the Meckel's cartilage, the coronoid process, the condylar process, at what age the symphyses are joining, the mandibular symphyses are joining, and all those. Then the next is the stages of development. So whether it is late fetal, it is infancy, early childhood, late childhood, or adolescence. So in this section, they'll be covering the primary dentition, mixed dentition years, and the late dentition also. So all the theories like what is the leeway space, what are the primate spaces or the simian spaces, and all the development, growth and development of the jaw would be covered here, like the primary dentition and all those. Then the malocclusion and classification, cephalometric analysis. So cephalometric analysis, regarding this, there are like questions which ask about the SNA angle, SNB angle, and how the growth of the jaws are happening. So on the basis of those values, those angles, you can say if your maxilla is ahead or your mandible is ahead. So the skeletal growth, the dental growth, and even the soft tissue growth, the soft tissue patterns. Then the crossbite. So as I said, the crossbite is a very hot topic and they love asking about the crossbite. And we have a reference also where they're talking about the unilateral crossbite. So one must know that how to manage a crossbite, whether it is a unilateral or a bilateral. it has a functional shift or it doesn't has a functional shift, and the midline diastema, like the management, and again the crowding management. Type of anchorages, the treatment time. So for each condition, like when you have a growth spurt at your hand, you can apply various treatments at different times. So for which treatment you have to start when, you should know that. So like as we know that for the class 3 patient, you have to start early, that is in the late deciduous dentition. So with the treatment time, it is divided into the late deciduous, early mixed, or late mixed. So one should be well aware of all the treatment times for all the conditions. Then the habits, the movement, the biology of the movement, the at a microbiological level, like what is happening, the frontal resorption and all, and the types of movement, along with the concepts of center of rotation and center of resistance. Then the contemporary ortho appliances, the growth modification, which would include the functional and orthopedic appliances. With the functional appliances, you will have a fixed appliances and a removable appliances. They love to ask a lot about the fixed functional appliances, and the orthopedic appliances are, it's an important topic as well. Then the orthognathic surgery must be given a read to. So this was all about the orthodontics and growth and development. And now the next topic is the pediatric dentistry, its references and the important articles. So pediatric dentistry, as I said, that of all of them, it is very important, because like many questions are asked from the pediatric dentistry. And if we talk about the references, I think McDonnell, Avery Dean 2016. It's a beautiful book, and it's a 10th edition book. And along with this, you can have Novate A et al., that is Pediatric Dentistry, Infancy through Adolescence. Both of them are very good books. Like you can have either one of them as your references or both of them. So I'm having both of them. Then if we talk about the articles of the pediatric dentistry are very important, They are important because the major chunk of the pediatric dentistry is covered with these articles. So whether it is trauma or whether it is pulp therapy or the restorative dentistry, so in and all, it covers everything, and one should know like everything. So as a fact, we have been like repeating it time and again that we know it's not possible to read all the books with the articles. One should be very thorough, like with each and every line one should know that what is happening with which article. So articles, again, they are very important. So we'll start with the American Academy of Pediatric Dentistry article. The first would be guidelines for the management of trauma, the traumatic dental injuries. So it has, like for the trauma, we have 3 articles. One is focusing on the primary dentition. One is focusing on the permanent dentition, the injuries of the permanent dentition, the fractures and luxation, and article wholly solely has been dedicated to the permanent dentition avulsion. So avulsion, with the avulsion, you need to know the medium, the storage medium, and like it has been categorized into like 3 category depending upon the time when you are doing the treatment, whether you're doing it on the spot or you are doing it within the 60 minutes or after 60 minutes. So it all depends upon the viability of the periodontal tissues. So avulsion of permanent teeth, it's again a very important article. Then the article on the antibiotic prophylaxis for dental patient at the risk of infection, the guidelines on the caries risk assessment and the management of infants, children, and adolescents. So caries risk assessment along with the ICCMS, they both are the pillars for the risk assessment and management. And in this article, the management part is also given, and it's been divided into like the children which are less than 6 years and the children who are greater than 6 years, and then the management, different management for both of them. So it's beautifully mentioned with the tables and everything, and it's an important one though. Then with the pediatric restorative dentistry, all the restorative materials which we need to know, starting from the GIC, the composites, the amalgam, and even the stainless steel crowns. So a comparison has been done for all of them with the evidence and with all the meta-analysis and all the studies. So it's a beautiful article which tells you all about the restorative dentistry and even the indications, contraindications, and everything about them. Now, the other articles are the pulp therapy one. It's again, the pulp therapy is very important. So all the concepts here, the right from the vital therapies, the non-vital therapies for the primary teeth, it is different from the immature permanent teeth, and for the permanent teeth also they are different. So the indirect pulp capping. So this all forms the base of the pediatric dentistry. So where to do the indirect pulp capping, where you have to do the direct pulp capping, what is happening, where to do pulpotomy, what all materials are recommended for pulpotomy. So all of them. And yeah, so regenerative endodontics is also a very crucial stage, or it's a crucial step or a crucial treatment for the immature permanent teeth. So that's again a high yielding topic. Then the informed consent, the policy on the role of dental prophylaxis in the pediatric dentistry, policy on the use of xylitol. So it's a very, both of them actually, the xylitol and silver diamine fluoride, they both are very short and sweet articles. In the xylitol one, they are talking about the problems with the xylitols, whether it is effective or not for the caries control. And silver diamine fluoride, the silver bullet, it is very in these days, even we use it in clinics, and it's a very effective tool where the other things where you cannot use, like for the uncooperative patient or the patient where um, you cannot do the regular treatment for the cavitated caries lesion. So silver diamine fluoride, it has proved very effective. So the chairside guide for the SDF and the management of the dental caries lesion. It's a short one, but it's very important one again. Then the management of dental patient with the special healthcare needs. AAPD 2021, here they're talking about the special healthcare needs patient, and one should also give it a read since it's there with the references. Now, the important topics for the pediatric dentistry are the teeth formation, like all the timing, the eruption timing, the calcification timing, and everything, along with the apposition stage and all the stages of the teeth formation, the cap stage, the bud stage, cap stage, early bell, late bell, and what is happening in what stage, like in what stage morpho differentiation is happening, or histo differentiation is happening, or apposition is happening. So all those things. The pediatric restorative dentistry, all covered in that article. Pulp therapy of primary teeth, immature permanent teeth, and permanent teeth, again very well given in those articles. The space maintainers and the management. So regarding the space maintenance, one should know about all the space maintainers, the indication of them, the advantages of using them, the disadvantages of using them, at what stage which space maintainer should be used. So like all of them, right from the band and loop or the lingual arch or the Nance appliance and all of them. Then the trauma, and I feel like all of the trauma is important, but I think there are more questions from the avulsion and intrusion. So but one should be thorough with the article, with the trauma article. So three of them. Then the child abuse and neglect. So one should be well aware that if you see, one should know that how to recognize a child abuse, then report it, and then you have to then you can do the treatment. So child abuse and neglect is another hot topic, they really love asking them. Then we have the next section, so geriatric dentistry, and all of them, like the ortho, pedo, geriatric, growth and development, all of them, they comprise the 10%. Then with the geriatric dentistry, the reference which is mentioned with the NDEB is Clinician Guide to Oral Health in the Geriatric Dentistry, that is by the American Academy of Oral Medicine. And the article which is not mentioned with the NDEB is the pharmacotherapy for the elderly dental patient. It's a very important article, like everything related to the elderly dental patients is here, and it is by the Journal of Canadian Dental Association 2015. The important topics for the geriatric dentistry are the normal physiological changes with the aging. So with the geriatric patient, one should know that as we age, the pharmacodynamics of a patient and the pharmacokinetics of a patient changes. And when there's a change with the pharmacodynamics and the pharmacokinetics, there's a change with the prescription also. So you need to alter the drug dosage and the drug duration also. So changes in the prescription of drugs commonly used in the dental practice, and especially the antibiotics, analgesics, and LA. So we talked about in pharma also that how antibiotics and analgesics are so important. So also the changes in the prescription which are revolving around the antibiotic and analgesic specifically. Also the adverse drug reaction in the elderly patient, and the drug interactions. So both of them. So we know that elderly patient, they have like a lot of medical conditions and they do take over the counter medication. Because of that, there are drug interactions and even the adverse drug reactions. Now the embryology. So all these references are there with the NDEB, but the important topics with the embryology are the brachial arches. So the brachial arches or the pharyngeal arches are very high yielding, like each and every part of them, the derivatives from the pharyngeal grooves, the derivatives from the pharyngeal arches, the innervation, like what structure is coming out of them, whether it is skeletal structures or the muscles which are coming. So pharyngeal arches in and out, one should know them, and it's very important. Then the clinical relevance for the formation of the face and the palate, and that would include the nasomaxillary process, the frontal process, the maxillary mandibular, sorry, the frontal nasal process, the maxillary process, and the mandibular process. And then the if those things are not fusing at times, like the cleft palate, the hair lip, and all of them. So again, a very high topic. And then the development of tongue along with the innervation, the lymphatic drainage, the arterial supply, the venous supply. So all of the tongue is important. So I think that's all for this, the 10%. And thank you for watching this. Thank you for the patient listening. Do not forget to subscribe to this channel. We're going to be coming up with the more updates in this blueprint, like the rest of it which is left. And so stay tuned to this channel, like, share this video, and subscribe to this channel. Thank you.